Seizures and epilepsy come in many different forms, in many different shapes and sizes. Um, uh, Trying to get hold of all types of seizures and all types is indeed a challenging task for even neurologists, right? But uh, some of the common seizures are the tonic-clonic seizures. So in the tonic-clonic seizures, which are very easy to recognize, and fortunately, I think it's not really necessary to be a doctor, leave aside an epileptologist or a neurologist, to be able to recognize most tonic-clonic seizures, right? So that's the good part of it. So at least the tonic-clonic seizures can be easily recognized. And these seizures, they typically begin with a fall, a loud cry, the body becomes stiff. That's the tonic phase. It is followed by a clonic phase in which there are to and fro movements of the limbs. The eyes are uprolled. There is clenching of teeth. There is frothing from the mouth. And as I said, a loud cry. And the person is lying on the ground or wherever, right? And this goes on for usually less than a minute. Most tonic-clonic seizures last for less than a minute. Which is the tonic-clonic phase, right? The stiffness and then the clonic movements, right? To and fro movements. They usually do not last for more than a minute. If they last for more than a minute, and particularly if they last for more than 5 minutes, that's a difficult situation that is known as status epilepticus, and it is a life-threatening emergency which needs immediate transfer to the emergency service of a hospital and immediate treatment, right? But what happens after this 1 minute of a tonic-clonic phase is the person is usually unconscious, right? And he or she might be unconscious for nearly about 5 minutes, 10 minutes, 15 minutes. They gradually, slowly recover consciousness, right? And if someone recovers consciousness like this, becomes like a switch, an electrical switch, and becomes completely normal. That's probably not a true seizure. That's not probably an epileptic seizure. It's something else, either a psychogenic seizure or something else, right? And then for some time, the person is usually confused. You try to ask him lots of questions and will not be able to reply to those questions appropriately. The responses might be slow, the responses might be delayed, the responses might be inappropriate, right? And during the seizure, a couple of things. There might be incontinence, right? And which means that the person might lose control of his bladder or bowels. And sometimes the patient or the individual with who just had seizures might actually bite his tongue, and there might be a tongue bite, and there might be some bleeding within the mouth or coming out of the mouth during the seizure. So that's a tonic-clonic seizure, right? But as I said, seizures come in many different forms and shapes, different forms, and there are several other types of seizures. And it is important that we need to recognize these other forms of seizures. Some of these forms of seizures are known as non-convulsive or non-motor seizures, which are absolutely, the person might be still for a few minutes, right? Or the person might have some vague movements of the repetitive movements of the mouth or the oro-alimentary apparatus or of the hands, and these repetitive movements are known as automatisms. And these strange movements and complete behavioral arrest, right? A behavioral arrest means that the person is like a stone, right? He's unresponsive. You try to talk to him, he's not responding. He is unaware. And the current term is not awareness or responsiveness, it's consciousness. So they actually lose consciousness. So you try to talk to the individual, he's not responsive. You try to uh, interact with the individual, is not interactive at all, does not respond, and that also can be a seizure. There might be eye blinks as an absent seizures, very brief. Uh, Students in a classroom, children in a classroom, and there is a class teaching session which is going on, and suddenly you find that they become unresponsive for a few seconds, little bit of blinking of the eyes, and they come around very fast, just few seconds, 10 seconds, 5 seconds, 10 seconds, or so on and so forth, right? So seizures come in many different forms. Um, it's easy to recognize tonic-clonic seizures, but it is also important to recognize the non-convulsive, non-motor seizures, because there are now a number of studies which have emphasized that one of the main reasons for diagnostic delay or a diagnostic gap, which means the diagnosis of epilepsy is delayed because a good proportion of these people just have non-convulsive seizures, and no one realizes that these are epileptic seizures. Some people think this is just a normal kind of thing, and therefore no one seeks medical attention. And sometimes when these people go to the emergency of service of a hospital, the emergency physicians also do not recognize them to be seizures, right? So
Right.
these non-convulsive seizures are a very important cause or reason for the epilepsy diagnostic gap and epilepsy diagnostic delay, right?